Hey everybody, what's up? Physical therapist Dr. Whelton. So, I just had this physician in my clinic, okay? 1 year of this mysterious arm pain, numbness, and tingling, okay? So, she said that I got this like tightness in my arm. She's like, I do work all day, I chart, just like we do, right? And so she's like, at some point my thumb started to have some issues. So I went and I saw, an ortho, and they scanned my neck, and a little bit of an issue at C5-6, but nothing to write home about, right? EMG negative, right? And I'm like, I know what this is. I know what this is because the people that have failed everything, like this medical doctor for a year, okay, that have this sensation down their arm, it doesn't show up on an X-ray and MRI, and nobody checks for it, right? So anyways, I rule out the carpal tunnel, right? No carpal tunnel, right? Phalanx test, no carpal tunnel. I rule, she has a little bit of thoracic outlet syndrome coming from the pecs and the scalenes, okay? Just a little bit, but nothing to write home about, okay? But then, as I'm talking, I'm like, here's what my thought process. She was a physician, so I just told her where my thought process was. I'm like, I think you got nerve tension, nerve entrapment, but mostly nerve tension, I'm like, she's like, cause she says in my arm, I can't go like this. It's so tight, I'm like, I think I know what this is. So anyways, bring her out, do ulnar, radial, median, right? Boom, the tension's gone. And I'm like, that's what it was, nerve entrapment. No one checked for it. Neurologist, orthopedic, I don't know how many other people she saw. She did PT, nobody checked for it, okay? If someone has this mysterious tension down their arm, like they're not like, it's not like they just don't stretch their arms. Check for nerve entrapment. And if you do the gliding and if they feel better immediately, then that's what it is. And you create that, okay? And you just do the gliding. And you can work on their posture, work on their periscopial muscles, and they're good, all right?